Good afternoon. My name is Kemal Erkan. I'm the chairman of American Surgery Center. I'm here with Dr. Isaias Irgau. This is our Bariatric Friday event. We are trying to be the voice of patients who are struggling with morbid obesity, and that's why we are here every week. And our goal is to inform, educate our patients, public, and then try to make it a little bit more easier for people to understand. That's why we are taking topic by topic, and that's hopefully that's how we are able to help more people. And Dr. Irgau, I know you did a lot of cases today, but while we were doing those, we did talk about you for about an hour with our team.
Thank you. Thank you. I am honored and privileged, Kamala, and I appreciate immensely your efforts as well as those of the United Medical team. Thank you.
It's our pleasure. So today we are going to discuss the support group aspect of bariatric surgery process. And support group is important, not just prior to the surgery, but it's even more important perhaps after the surgery, because there will be a little bit less availability. I'm saying less, but that's just compared to the prior to the surgery, obviously. So, Dr. Irgau, if we can actually just give the background on support group and why we are doing it and how we can actually help people to better understand and better utilize the Surgery Center, American Surgery Center support group from our patient's point.
Absolutely. Support group sessions are very important after bariatric surgery, Kemal. To just relate on the importance of this, let me just talk to you about a case I did on an emergency basis this morning at the hospital. So a patient showed up with evidence of bowel blockage after gastric bypass. That is something that can happen. We know, of course, and we're here to take care of that. But what struck me about this situation, Kemal, is that this patient had gastric bypass in 2008 at the University of Pennsylvania. Very good place, very reputable bariatric center. But it's the disconnect between, her surgery and then the follow-up. She hasn't had any follow-up for really many years since then. And that is problematic. That's problematic because a bariatric patient should be a patient for life with their bariatric surgeon. Clearly, it is possible for people to move geographically afterwards, but it's important that they connect with bariatric surgeons in their area. And our bariatric center, of course, is here for our patients, but we're here also for any bariatric patient that may be needing follow-up afterwards because they have moved to our area. Because this patient has not had sustained follow-up and, of course, possibility to do support group sessions like the one we're going to talk about today, Kemal, this patient had regained considerable weight and has not been able to really get any help on how to get back to basics and to seek help, right? Importantly, there is no clear information about her vitamin intake or the vitamin level after gastric bypass, which, as we've said in many sessions in the past, Kemal, it is critical for patients who had gastric bypass to have an ongoing check on their vitamin levels, that they have to continue taking vitamins.
So we do cover that in our one of our regular episodes on a regular basis.
Absolutely, absolutely. So the importance of ongoing support in the form of support groups that we're talking about right now and follow-up with the surgeons is really important for long-term follow-up of our patients, right? So not only we're talking about weight loss that has to be sustained for life, we want patients to become healthier from their weight point of view for the rest of their life. But there may be issues and problems related to their surgery that can come up in the long term. And if there is no ongoing follow-up, that is not going to happen, right? So what is so specific about the support group? Well, a support group is a periodic meeting, and ours happens once a month on the first Tuesday of every month. And now days thanks to Zoom. It's a virtual meeting, so patients can attend to it, wherever they are. But what is important is obviously we raise topics that are relevant and pertinent to the patients, right? What kind of vitamins am I supposed to be taking, right? What happens if I have excess skin after I lose weight?
Mhm.
What happens if I start struggling with snacking again? That is a threat to my sustained weight loss. What happens if I have issues with self-image, for instance? I am having a hard time seeing myself again as a thin person. What happens if I have anxiety about my relationship with others because of my weight loss?
Mhm.
What happens if me losing weight is a threat to my relationship with others? These are important issues that can affect any of our patients, and discussing them in a group session, with one of us leading that, is actually liberating for the patients, but also it frees them from, some difficulties about bringing out these issues. And when they come to the support groups, Kemal, they can be just listening all the time without saying any words. They can be actively participating, or they can be asking questions. So the gamut is wide. And as I said, because of the virtual setting right now, people, even if they have reservations about their privacy, they can just, turn off their camera or mute themselves and just listen. And that by itself is also immensely helpful. Because very often the other side of the issue, Kemal, is that when patients struggle, for instance, with weight regain or, snacking, they may be afraid about bringing up those issues, or they may feel ashamed about bringing those issues, right? But when they see that there are others also who are struggling with the same type of issues, then they may feel much more comfortable about bringing those issues. So bringing those issues, discussing them as a group, and then finding solutions and implementing the solutions can resolve many of the problems with which patients struggle. Okay, so what we're saying essentially is that bariatric surgery is different from other surgeries, it's different from gallbladder surgery, different from hysterectomy, where you have a single encounter with your surgeon or your surgical practice, and then you move on to your life. With bariatric surgery, because of the changes that we undertake on the digestive system, an ongoing follow-up is important, and part of that follow-up is the support group setting that we think is so important that we are dedicating a whole session about it today, of course.
So now, thank you, Dr. Gat, and you are absolutely right. So there are ways to communicate the issues, because there are a lot of different things that are happening with this process of the surgery and what also is happening after the surgery. I think one big part of it is, as much as our Tuesday sessions are helpful for that once a month with the surgeon being there, but we also have a Facebook support group.
Yes.
And I do want to spend a little bit of time on that. So what I see, and you and I, we are checking those on a regular basis, and our team is looking at that. There is this, not just, it doesn't have to be an issue. People want to share what they're going through. They want other people to know what they're about to do. When they start, like I read one of them saying that I'm on the second week of robot diet and super excited about getting healthier and enjoying hiking like I used to. So, well, there's no problem here, right? But it's in the support group, because we only, we do much better when we are able to share these. It doesn't have to be just a problem. So when, of course, for those who are also following us, I do want to remind them to be mindful of the support groups, because this is not a platform to make individual complaints about difficulties that they may be experiencing, not related to the surgery itself, but just because they called offset and no one answered. That's not the support group is for. This is a place for specifically for the actual, like anything that's involved with the surgery and after surgery, and how you're how you went over the challenge of, doing the robot diet, if it's for 3 weeks, rather than, complaining about, oh my God, I have to do robot for 3 weeks. Well, the only reason someone may need to do robot for 3 weeks, we explain them, right? But it's not a place to complain about that.
Right.
Because if your BMI is over 60, chances are you're going to do 3 weeks diet, because we want your surgery to be less problematic, because you need to reduce the liver, the fat around the liver, right? So it's not because we want to surgery, but that's not. You can say that 3rd week is tough, but if it goes into, oh my God, why do I have to? That's not a place, because we have to respect everyone else. But I was trying to actually just point out, most of the messages that I read there is they just want to share what they're going through. And that's nice. But also when we see questions, then we are also able to address those, and then we are able to cover those on the surgeon led specific session. So I think between the two, having the Zoom event and also having the specific page, there's enough resources available for the patients.
Absolutely.
This is because there's a big change in their life journey. It's not like when you take someone's gallbladder, they don't want to talk about it, because chances are there is not much change is happening. But when someone is losing 100 pounds, 150 pounds, you want to share that.
Yes.
They want to share, because that person has been struggling with morbid obesity for their entire life. And the best way to make that more enjoyable and doable is when you are able to share with people who are going through the same issues, maybe in different stages, but they went through the same thing before, or maybe they're going through the same thing now with you. And I think it makes it easier for those individuals. That's what I have been seeing so far.
Absolutely. See, the interesting thing about the support group, Kemal, whether it's at the Facebook level or the regular meetings that we have on the first Tuesday of every month, is that there is something liberating about knowing that there are others who share your same concerns or your same joys, who travel the same journey, essentially. And I think this is no more true, than for patients who've struggled with obesity for a long time. And the reason is, Kemal, as we said in many sessions, because obesity has been ostracized by society for so long. For people with morbid obesity have almost suffered in silence, without having had a safe space where they can come out and really share their agony with this disease. So now that there is a way of liberating themselves from it, through bariatric surgery, which is not an easy decision to make for many people, right, Kemal? Despite the fact that we are talking about the efficiency, the effectiveness of bariatric surgery, how effective it is and how safe it is, a lot of people still are afraid of taking that first step. And we see this on the data also that shows us that barely 1% of people who are actually eligible for bariatric surgery end up having bariatric surgery. And so when you come with all that apprehension, it is really very, very important to have a safe place where you can share your own experiences, or you can ask questions safely also in a setting where there are other people that are going through the process like yourself, and which is obviously led by a program that is committed to taking care of patients who suffer with morbid obesity.
And I do want to kind of share the rules that we have on the bariatric page, bariatric support page. Be kind of courteous, and no hate speech, bullying, no promotion or spam, and respect everyone's privacy. So those are kind of like, we are limited with 4 rules there. So there are a couple others that I normally want to add, but That's where we do that. We do it here, so then I remind people. So, and it's very easy to sign up. You can do it from our website. And actually, I do want to kind of demonstrate that.
Great.
Let me just open a brand new page. So basically, when you are on our website, this top right corner is where everything is happening. So you can sign up for the weight loss webinars, and then support group meeting. This is a Zoom meeting that you can register, and you can also do the Facebook support group. So if I were to go here with the support group meeting registration, it will take me to the Zoom where I have to register. And that's where you would do this. And for the Facebook, if you were to click on the bottom one here, on this top right corner, and the Facebook support group, so that will take you into the bariatric support group, and then that's where you would actually start the process. So it's extremely easy to sign up, and it's a good way to communicate. Other than that, Dr. Ergau, anything that I mean?
Yeah, I mean, what we're saying here is not just based on how we, see from our own experience, but actually there is data in the literature showing that bariatric patients who participate on a regular basis on support group meetings as part of their follow-up process with their bariatric process actually do better in terms of the actual weight loss and maintenance of that loss. So there is data showing that. And so, as I said, in our practice, besides the ongoing, Facebook support group that we have virtually, we do have this scheduled organized meetings that we have the first Tuesday of every month, which means we have about 12 of them a year. And if patients can participate in anywhere between 4 to 6 or higher a year of those meetings, I think that will keep them engaged, Kemal, and that's what I'm saying. So they don't have to come on every session necessarily. If they do, that's great. And there are some patients who do that. And I love that. That's really fantastic. But at least if they can come, every other month or every 3 months, so that they are participating on a regular basis for them to stay engaged, to stay in touch, that will also keep them focused. And I think they will show the same, positive results that we've seen in the literature, in terms of how important it is to participate in support groups.
Absolutely. And these are some of the reasons, again, stay motivated, reinforce that you are not alone. Share stories and information, not promotion. Get support for new behavioral skills, receive encouragement and guidance, and enjoy a little healthy competition. Well, I think that's also important, right? So
Absolutely.
when other people are losing, if someone lost 140 pounds, and if you're at 110, you may want to try to catch up with them. So, but it's just like knowing what others are going through that does really help. And this is not just for bariatric, right? The other parts where we need more help. These types of coordinated support groups are always helpful. Absolutely. So I'm just trying to see if there's anything that I missed. The other thing that I want to mention while we're on the support group, reaching out to our office. Now on our website, you don't necessarily call for everything, but you can actually put a ticket for us to reach out to you. So the reason for that, why that's important, is because When you do that, we see it. Everyone sees it. When you call, I don't see it. But when you put a ticket, any other businesses, if we are not able to answer right at the time of your call, just put a ticket. So then we know when you called who actually tried to reach out to you. Then if someone else missed it, someone else can pick it up. So that's also it's important from the support side, right? Because in some cases, I see people are frustrated because, they called and we didn't answer. Well, there's a way to do it. Just open a ticket. So then that's going to make it a lot quicker for us to
Absolutely.
So those are what I have, Dr. Irgau. I don't know if you have any. Now, one other thing, that support group on Facebook is a private group, so you won't see unless you are approved by us. People are not going to be able to see what you are doing there. Only people who are part of the group can see what's being posted, and then we do verify them individually to make sure that they either had surgery or they're about to get surgery from our program. So that's probably important for some people because a lot of people are concerned about their privacy, and that should be helpful.
Absolutely. The other thing to mention also at the same time, Kemal, is the fact that particularly for the monthly bariatric support groups, I do encourage patients who are going through the process before their surgery to also participate, whenever they can, because a lot of their anxieties actually can be alleviated by knowing how many people actually have gone through the process successfully, right? Or many of the questions that seem to be unknown to them at that time because they haven't gone through the surgery can be answered, in settings of support group because others are able to share their experiences. So when we're saying support group, it's not just for patients who had the surgery, but also who are patients who are either exploring or preparing for the surgery itself. So it encompasses all of them essentially.
Yeah, absolutely. And also these Bariatric Friday events are part of the support as well, right? So the reason we are doing it every week, and we do it every 3 months, we repeat the topics. The reason is because one of them may get your interest and may answer your questions. So there's so much available out there to get the best help and timely help, and that's why we are here. So hopefully we can.
Kemal, I have to tell you something funny. I had a patient coming for their surgical clearance the other day. And then I asked them if they had any questions, and they said no. They said they have watched so many videos of Bariatric Friday. I was up until 2:00 in the morning the other night watching videos, and they got a lot of information.
It's better than the Netflix show, right?
Very, very, very valuable.
It's much better than the Netflix show.
For somebody seeking the information, no question. Yeah.
Very well, thank you. All right, Dr. Irgau. So we'll be back next week. Until then, have a great weekend, and we'll see you soon. Thank you.
Thank you very much.